is a growing health concern in many parts of the world, including Kenya, and it can have a significant impact on a person's quality of life. Through this program, we aim to provide you with the latest information, insights, and advice on how to manage and prevent kidney disease. We will be speaking with a leading kidney specialist, that is Dr. George Moturi, who is a nephrologist, who will share his expertise on kidney disease management, including the latest treatment options, dietary and lifestyle changes, and preventive measures. We will also be featuring the inspiring story of John Gikonyo, who is the President, Renal Patient Society of Kenya, who has overcome kidney disease and is living a healthy and fulfilling life. So, whether you are currently living with kidney disease, have a loved one who is affected, or simply want to learn more about kidney health, this program is for you. So welcome to the program, and welcome Daktari and also John to the program.
Thank you.
Thank you very much.
Asante sana for being here, and we just celebrated World Kidney Day in the past week, Daktari. Maybe I could start with you. Why is it so important to actually mark this particular day?
Thank you very much for the invite here. World Kidney Day has been celebrated for the last almost 10 plus years, since 2006, started by the International Society of Nephrology and the International Federation of Kidney Foundations. So every year we have been doing these celebrations. The main objective is to create awareness, amplify the kidney disease issues among our population, among ourselves, so that we can go out there and do screening as frequently as possible. They call kidney disease one of the silent killers. No symptoms until very late. And when it comes late, you can't do anything about it. So that's why World Kidney Day. Now we actually talk about World Kidney Month, National Kidney Month. So this month of March is National Kidney Month, but the culmination of the celebrations usually occurs every year on a Thursday, second week of March, every year. We'll always be having a standing invitation to be here at your studios.
Yeah, that's
every year to be coming every day. Maybe John can add something on that.
Yeah. What does it mean for you? Because you're actually part of the World Kidney Day celebrations. What does that mean for you as somebody who is a survivor?
Okay, thank you very much. I think World Kidney Day is an important reminder of the burden of kidney disease, both globally and nationally. We are now told that about 10% of the world population has some form of kidney disease. So if you take the world population at 8 billion people, that's 800 million people walking around with chronic kidney disease. Bring that to Kenya at a population of about 54 million now. That's about 5.4 million people. Kidney disease is projected to be among the 5 leading causes of death by 2040. It's a very expensive disease to treat. Currently, it's the most expensive disease among all the treatments that are covered by the National Health Insurance Fund.
So we will be getting to especially the expenses that come with managing kidney disease. Yeah. And rightly put, you said it's very expensive, especially for most Kenyans who are affected by kidney disease. But Daktari, probably we could start by just in a nutshell, what is kidney disease?
Again, a very pertinent question to ask so that we can have a definition of sort of working understanding. Yeah. Kidney disease means your kidney is not working well. Working, meaning that it's not filtering your blood, it's not removing the toxins. When you eat food and when you're working, your metabolism is working, waste products come in and the kidney removes them. If they accumulate in the body, then that is dangerous. That's the function of the kidney. When you drink water, you go to the toilet to pass out, that is the kidney working very well, and we're all happy about it. It's amazing kidneys. So kidney disease means that function is abnormal, or sometimes the structure of the kidney. Maybe you are born with one kidney. That means the structure is abnormal. Ordinarily, Kenya, God made you to have 2 kidneys, but sometimes you're born with one for one reason or another. That means you have kidney disease. Once it's more than 3 months, whether function or that structure is impaired within 3 months, then that's chronic kidney disease. Once it's less than 3 months, that's what you hear people talk about, acute kidney disease. Acute is usually amendable, treatable, and you can recover completely and properly go back to your usual life. Chronic is the one you hear people talking about. What stage is it?
Yes.
Then you get stage 1, 2, 3, 4, and the very last one, stage 5, which is called end-stage kidney disease or kidney failure. So stage 1, 2, 3, and part of 4 is actually asymptomatic, totally asymptomatic. You are unlikely to know. The only way you can know is like in this period of World Kidney Day, go for screening. So we advise anyone who's more than 24 years, no, more than 20 years, particularly more than 40 years, life starts at 40, it appears, more than 40 years, you must go and ask your doctor, your medical person, what's your kidney function, then from there you follow it up. And anyone who's in a family where there is a chronic kidney disease, then you always check. Or anyone who's high risk, you have hypertension, diabetes, you're overweight, or you have any other comorbidities or illness, you always ask to check your kidney function, because then you can forestall it from going from 1 to 5 when it becomes totally unbearable.
Okay. Annual screening, like we've always been told, at least once a year you should be able to see your doctor, and for your kidney health, that is part of it. So, John, you are a survivor. That is where I would actually call you a survivor of kidney disease. But maybe just take us back, and maybe just in brief, when were you diagnosed, and what has been the most challenging part of living with kidney disease?
Okay. I was diagnosed in the year 2009, and it was a very interesting diagnosis because I was not sick. And that brings me to the point I was talking about 5 million people with kidney disease.
Yes.
One would ask, where are they? Why aren't we seeing them? It's because chronic kidney disease has got no symptoms, at least in the early stages. So when you're in that state, you may not know. So majority of those 5 million people do not know. Okay. So back to my diagnosis. I was at a hospital and I was going through some farmlets and I saw Wellman Clinic. Okay. I had a sick child in that hospital and I was spending a lot of time there. You know, when your child is admitted, you're also admitted in a way. So I decided, while I'm here, why don't I have my health checked? So I did the check, and that's why I was told that there's every indication that I have chronic kidney disease, and it is not irreversible. And this might progress to kidney failure, at which point I will need a renal replacement therapy. That would be dialysis or transplant. I usually compare that with an earthquake.
Yeah, because I'm just about to ask you, like, you were just in hospital, minding, can you say, your own business, taking care of your child. You decide, let me take this opportunity, and then boom, you're told actually you have this disease that is not reversible.
So it's like an earthquake or a hurricane to be told that, you know, you have kidney disease. I would rate that at a category 12 hurricane. To be told that your kidneys are going to fail and there's nothing you can do to stop it.
And you had no symptoms, like Dr. has said? No. None whatsoever?
No. And I didn't have them for a long time. Even after knowing, I did not have them after a long time. But now, because I knew, I was able to work with my doctors. The only thing we could do at that point was delay the onset of kidney failure, most of which you can only do through diet. And that's now when you start learning your very many bad lifestyle and eating habits. So you have to stop eating and using a lot of stuff. You have to also start eating and using a lot of stuff like drinking more water and things like that.
We will be delving into some of those healthy lifestyle that Atari and even you will tell us what you've adapted in your own life. But how has it affected your life? You know, did it change anything? Because all of a sudden, at one point, life was just normal. You know, you're eating anything that you want and all that. But how has it affected your life?
Well, I would say it changes everything. The culmination of this diagnosis is that I did a transplant in 2015. And I don't know about other people, but when you have that kind of an operation, you don't, it's a different person who wakes up from that operation table. You will have changed a lot in terms of outlook to life, attitude to life, lifestyle habits, your diets, and so many things. It affects your work because at some point you're unable to work. Some of the effects of the toxins in your body before you get to dialysis or the transplant and the drugs that you take after the transplant, all these change the way your body functions, the way your mind works, and all those things. So there are very many changes that happen in your life. But all in all is that if you are able to follow the directions of your disease management or treatment team, you can lead a normal life.
Okay.
Yeah.
Dr. John has just depicted exactly what you're saying. No symptoms whatsoever. You walk in and you're tested, and there you are. Life has changed for you and all that. So what are some of these causes of kidney disease? Because for him, he was living a normal life like many other Kenyans, you know. So what are some of those things that we can actually look out for that can actually lead to kidney disease?
Thank you. That is one of the most important questions you've asked, so that at least if you are what we call high risk, you have one of these situations, conditions, or illnesses, or healthy problems that will predispose you to chronic kidney disease and eventually kidney failure, then you can be able to screen early and then prevent progression towards kidney failure end stage when you require dialysis or transplant. So the commonest cause of kidney disease is first metabolic diseases, what we call lifestyle diseases. Diabetes and hypertension, by and large, are common causes of end-stage kidney disease or kidney failure. But another group of causes of kidney disease, especially in sub-Saharan Africa, are infections. Malaria, chronic malaria, common infections in the throat, bacterial infections, viral infections, those can predispose you to chronic kidney disease. And recently COVID, you can get a COVID episode and somehow kidney gets involved, and over time you end up with chronic kidney disease. And I've got a few colleagues or friends of mine or patients who I follow who have just had COVID, and that's when their kidney disease blew out. The other cause could be genetics. We know we don't live in isolation, we come from somewhere. So if we know that one of our family members had kidney disease or was in dialysis or was told to have, then you can check. Commonest usually cysts growing in the kidney, like balloons of water in the kidney, causing high blood pressure, especially in the young people, and those have chronic kidney disease. But the most important message generally to the public, if you are between, say, 18 years old and probably 30 to 35 years old and you have high blood pressure, please, you must check your kidney function, because that blood pressure, there's a high possibility that it's being fired by the kidney disease.
Kidney. But just before I go to John and find out the treatment options that he had, because you were told now it's irreversible, what are some of the treatment options that people have if at all you found that you have a kidney disease?
So I don't wish to paint a gloom picture, and that would be wrong. You can have kidney disease, organ failures, kidney is one of them, the heart is the other, the brain is the other, the eyes are the other, the urinary system is the other, the intestine is the other. Whenever they are faced with a challenge and they fail, there's always something to do. You change your lifestyle a little bit, but it's not the end of the story. Your life changes drastically, yes, but you have to live on. You have to live and fulfill your reasons why God brought you in the world. So there are a lot of treatments for kidney failure. If you are told that you have kidney disease, I think at that point, if you are totally asymptomatic, you're very lucky. Then you are going to ask, what can I do to stop it, either reverse it, let it remain the way it is, or stop it towards progressing towards kidney failure. If it was going to take you 2 years to go to kidney failure, and it takes you 50 years, and life expectancy in Kenya is averagely 62 years, you will have lived your whole life, so it will not be a problem. So that's why whenever you are told you have kidney disease, and then the interventions that we put in place to ensure that you reverse the process, let it remain in the ways, or slow the progression, as John has said. So if it's diabetic, for example, and you have been told now you have diabetic kidney disease, then you put in measures. There are medications, drugs, not only to control the sugar, but the blood pressure, control your weight, control the other metabolic derangements that occur within that milieu, to ensure that if you are progressing quickly, you can slow that down. You can slow it down and live with kidney disease for 40 years, 50 years, to all your life, without necessarily going to kidney failure.
So it's not necessarily when it's diagnosed, then that means my life is over.
Not, absolutely not. Okay. Absolutely not. You will need to adjust your lifestyle a little bit to prevent it from progressing quickly, but it's not the end of it. But just in case, then relentlessly you're doing all that and it keeps on going towards kidney failure, then you have options. And while dialysis is the treatment of substituting kidney function that is easily available and accessible, it's not the best. It's tedious. There are 2-3 forms of dialysis that one can engage into. The commonly one that we do in the hospital is what we call hemodialysis. But the best treatment at that point is transplant, as we're going to mention, I'm sure, in the next 1 or 2 questions.
Yes.
There are different ways of approaching that. At the moment in Kenya, we do transplants among our patients and our doctors and different teams. And there are close to 10 hospitals that are doing that, government and private put together. And you can have a successful transplant and you can live a fulfilled life where a relative donates a kidney to you. When you donate a kidney, it does mean your life is also changed completely. In fact, you even fulfill a better life because you are screened before you donate, and then you live a more careful lifestyle and you will live a full life. And I know the laws are being put in place to ensure that eventually we end up with what we call deceased donor program, whereby people who pass on or people who have accidents, their organs are fully functioning, they can be harvested. Not only the kidneys, the heart, the cornea, the lungs can be given to other people to improve their life.
Doctor, I know we'll be getting to the challenges of organ donation, and you're exactly holding that thought. We will still get back to that. But just before we delve into those challenges, John, you underwent kidney transplant. How easy was it for you to get a donor?
About my transplant journey, I have 6 siblings, and in Kenya you can only get a donor, an organ donor from within your family. And when we were made aware of this, all my siblings volunteered to donate, and one was picked, and that was my sister, and she became my donor. So I did not have any challenges finding a donor at that point. But I know that is more the exception than the norm, because first of all, not many people have 6 siblings to start with. And you know, families are getting smaller. My own family, my children are only 2, so they have 1 sibling each. So it's becoming less and less possible to get a donor because family sizes are shrinking. But so a lot of people are facing that challenge, and I think that brings us to the point that we need to reevaluate this rule that says that only family members can donate. Okay. Because remember, one of the predispositions for kidney disease is having a family member who have kidney disease. So if you have a family member who has a kidney disease, you are more likely, or most likely to also get the same.
And just by seeing you here, Dr. we can more or less say kidney disease or kidney transplant is successful, because John is here speaking to us, he's living his life and all that. So did you have any side effects?
Not really. When you get a kidney transplant, remember this is a foreign organ that has been put in your body. The doctor call it a graft. And the next thing that will happen is that your immune system, which is there solely to kick out anything that it doesn't recognize, will kick out the graft. So for that not to happen, you need to take drugs that reduce or suppress your immune system to a point that it does not attack this new organ, but still remains viable to protect you from other diseases. So it's a balancing act, and you have to visit the hospital and your transplant team quite a number of times, especially immediately after transplant. At the beginning of the transplant, so that they create that balance whereby your organ is tolerated by your immune system, but you're also not getting infected. So there were no side effects, both for myself and my sister, who was my donor. And I would say it was a smooth.
So for you, it was a smooth. And that's not true. That's not for everybody. But
Yeah.
even as our time, I thought we had a lot of time to talk about this. But Dr. what are some of those lifestyle changes that people now need to adapt, to prevent themselves getting to kidney disease or even end-stage kidney failure?
Very good. You start, if you don't have kidney disease or you don't have any chronic illness for that matter, then you need to exercise, you need to take a balanced diet, mind what you're eating, and don't take medication annually when you have medication for pain, so always seek advice before you take any medicine or get unwell. And if you keep to those, you are likely to keep at bay most these metabolic illnesses that predispose you to kidney disease.
I feel like we've barely just touched the surface of the issue of kidney disease or kidney failure in the country. I'd like to have you come to the program next time, and let's just talk about the challenges when it comes to organ donation, like John had alluded to, and even the laws just surrounding the issue of organ donation, because that's where a lot of patients are having a problem. Yes, here you are, you've been diagnosed, you're supposed to go in for a transplant, but getting a donor becomes another big issue altogether. So I think that's an interesting area that I would like for us to discuss. John, in just a few seconds, your call for people out there, especially somebody who has actually lived with a kidney disease.
Okay, first of all, I would like to say that a kidney disease diagnosis is not a death sentence. We have enough expertise, like Dr. Moturi has alluded, in the country. And if you are screened and you are treated early, it is possible to manage your kidney disease. I have said I had a smooth transplant. The main reason is because I skipped dialysis. And I skipped dialysis because I was diagnosed 6 years before my kidneys failed. So by the time I got to kidney failure, I was ready for a transplant. So it is good to go for screening so that should you have any possibility of developing kidney disease, either the progression can be avoided completely, it can be slowed down, and if those two cannot be done, then you will be managed and you will have a smooth transition from chronic kidney disease straight to transplant without necessarily going through dialysis, which sometimes harasses the body.
Okay.
Thank you.
Thank you so much, gentlemen, for gracing our studios and speaking to us about kidney disease and all that it entails. Hope to have you very soon in our program. So thank you also very much for taking your time to join us for the program this evening. We hope to see you again next week. Remember